With people across the country staying safe, staying home, there's been a huge drop in the number of people taking public transit. Ridership is down between 70 to 90% in Vancouver, Toronto, and Montreal. And that has meant massive revenue losses, which could be a big issue down the road. Here with a closer look is Maddie Semiatiki, Interim Director of the School of Cities at the University of Toronto. Good to speak with you this morning.
Good morning.
So in Toronto, let's look there first. The TTC is blocking off seats. We've seen that, which could be required for months. Before the pandemic, overcrowding was an issue. So once things reopen, can transit really go back to being normal?
It's going to be a slow process to get back to normal for our transit systems. Transit has been an essential service, a lifeline service for people working in hospitals, working in food services and grocery stores, keeping our cities going, our country going. But as transit reemerges, as the economy reopens, it's going to be really difficult to provide effective public transit. Because of the need to maintain social distancing, we're still going to see a lot of seats blocked off, ridership below expectations, and people really hesitant to come back to public transit because of concerns about the virus.
Toronto's transit system has seen about $90 million in monthly losses. Once restrictions are lifted, will there be any money for improvements to transit?
Well, this has been a big question. Transit has taken a huge financial hit. We're seeing transit losing $90 million a month here in Toronto, similar orders of magnitude across the country relative to the size of their systems. So they're going to need a cash injection. They've been talking to their provincial and federal government partners. They're going to need money quickly and over an extended period of time because ridership is going to be below what it was before. Canadian transit systems rely more heavily on the fare box than in other countries. And so there's going to be a need for money coming into the system from the provincial and federal governments in order to keep it viable.
The Montreal transit system did the math. Once commuters return, let's say if only 15 people are allowed on each bus to maintain social distance, they would need 8,000 more buses. What options could fix this problem?
Well, we're going to need more service in the short term. We're also going to need to provide options that may accommodate transit and accompany transit, like improving pedestrian and cycling facilities, opening streets up so people can walk. A lot of the trips in our cities are actually fairly short distances. They're below 5 kilometers. They can be done by cycling, and trips under 1 kilometer can be done by walking. But we need to make sure that our cities are safe and designed to enable people to walk more readily. And so those services are going to be provided by opening up streets and providing cycle lanes. This is an opportunity to implement ambitious plans that enable people to use a wider range of transportation
Well, Maddie,
modes.
and I have to ask you, does this mean would people go back to using more cars on the road? Are we going to see more cars as a result of all of this, do you think?
This is one of the risks, and it would be a major downside coming out of the pandemic and the recovery if people drive more. Congestion and pollution would be a big issue. Our cities really have benefited from the increase in transit and people walking and cycling. It has the potential to reduce pollution and to reduce congestion. And so we have to be very careful. If people switch back to taking cars more because of concerns about their health, that will have a major detrimental impact on our cities.
Maddie Semiatiki, thank you for joining us this morning. We appreciate your time and your insight.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.